Good evening, everyone. This is Shreyan from IGCP. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by our keynote speaker doctors for today's podcast session on state of ART medical examination of survivors of sexual violence by medical professionals. With much pleasure and honor, I would like to welcome today's host, Dr. Sharda Jain, ma'am. Ma'am, welcome. Ma'am is the Senior Consultant of Ops and Gynecology Department, Director of Life Care Center and Life Care IVF, Expert Ethical Committee, NMC. Now, without any further delay, I would like to welcome ma'am at our forum and would like to hand over the session to her. Over to you, ma'am.
Uh, Thank you, Shreyan, for giving me an opportunity. Today is the Public Awareness Day for Sexual Health and Reproductive Health of a Woman. And I think the subject which we are going to take up today is very, very important. India reports a rape case every 15 minutes. And you'll be surprised that National Crime Report Bureau 22 highlights that 90% of rape cases go unreported. Reporting is only half of the problem. And we all know this worrisome factor has emerged in the last 5 to 6 years is that, one fourth of the girls and the women are killed or threatened after this incident of sexual assault. So, whatever we are talking about, whatever you people are knowing is only tip of the iceberg. Uh, I'm absolutely happy and delighted that in 2006, Ministry of Women and Child Development, Indian Medical Association, and the UNICEF had given us the responsibility to be part of making the protocol for the girls and the women who are trafficked for to be as a sexual worker. And we made a film in 2006, and that particular film was is used across the country to train medical doctors uh, for examination of sexual assault survivors. But in 22 December, the Supreme Court came very heavy and became serious that it is the training is required. And every doctor who examines these sexually assault victims should be thoroughly trained so there is no fault, because 50% of cases, because of the lack of documentation, because of the lousy examination, because of the collection which has been not done proper, the if the case goes against the victim. So what I feel is we will to help you to understand the gravity of situation. We'll show you a small part of the film. Uh, you just see, then things will be much better off. Shriyan, that film.
Sorry, ma'am, you need to minimize the screen and you need to play the video.
Okay. How do I minimize the screen? From the top.
Yes, yes,
Okay.
yes. Go to that video, ma'am. Yeah, and please
I'm
play it.
coming. I'm coming. I'm coming.
Video is playing.
On the website of the Crime Bureau of India is posted a crime clock. The clock never stops ticking, nor do the rapes.
This is a true illustration. A girl was brought from a village to a city for domestic work. She was sold to a brothel. She was recovered during a raid on the brothel. On medical examination, it was found that she had been physically tortured and her genitalia had been dilated with tampons to adjust to disproportionate male organ. She also showed old healed hymen and tears in the vaginal wall. She was tested positive for gonorrhea, and semen traces were also recovered from stains. An age determination test corroborated she was just 12 years.
A young girl is imported for commercial sexual exploitation. It is the beginning of repeated sexual assaults on the adolescent. The number of sexual assaults on her rise with every passing hour. Social scientists make 4 points. The statistics reported by the Crime Bureau are just the tip of the iceberg. Owing to guilt, shame, cultural compulsions, and poor knowledge of law, very few cases of sexual abuse are disclosed and reported in our country. It is a fact that both rape and sexual trafficking cases are on the rise. In our land, conviction rate of rapists and sexual criminals is very low. Varying from state to state, only 20 to 30% of the accused get convicted and punished. There is a relationship between conviction rate and sexual crimes. Higher conviction rate can help in the prevention of sexual crimes and trafficking. Doctors are the most crucial link in raising the conviction rate. In all the sexual abuse cases in the court of law, the evidence collected by the doctors through medical examination of the rape victim, the age determination test, and the medical legal report play a key role in deciding whether the offender will get convicted or not.
All of us are clear that to prevent rape and immoral sexual trafficking, the conviction rate must be raised in our country today. The right legislation is in place. What is needed is medical evidence that goes in favor of the victim in the court of law. As the nodal agency for controlling trafficking, Indian Medical Association is committed to raise the conviction rate and to get justice to the rape victims. Indian Medical Association's approach is bilateral. It is seeking the government support to establish rape crisis centers in the entire country. At the same time, it has taken up steps to equip the medical officers with the skills required for providing accurate medical evidence. This film is a part of that process. Just 1 minute. Just 1 minute. So now you've heard that whatever we are talking about, whatever the public of this particular country knows, it only tip of the iceberg. And somehow the conviction rate has to be increased. At present, this conviction rate is only 20 to 30%. And this is because of various reasons. Now, it gives me an opportunity to introduce my panel, which is people who are expert in this particular area. Dr. Sangeeta Gupta had been the head of the department of Basai Darapur, great teacher, and now presently the institute is associated, postgraduate institute has associated with Basai Darapur Hospital, and now she's a professor at Saraswati Institute of Medical Sciences at Hapur. We have another, again, a great teacher working in a big public health organization, Dr. Anita Rajoria. Dr. Anita Rajoria is head of the department of Hegdewar Hospital, and she has been part of the Delhi government in making the safe kit for the examination of this survivor of rape victims. And she has been also part of many things which designs and helps the Delhi government in various ways. So, at the outset, I'm going to ask Dr. Sangeeta, when a patient, we'll very loosely use a term which is called rape, and you give them the correct perspective, and also tell about, the country did not have any laws prior to Nirbhaya's case, and how the things have been brought about, and how the legal responsibility has come after 2010, since the government of India has chipped in. And you tell something about the Supreme Court, direction also in the same line, Dr. Sangeeta.
We all know that Nirbhaya case occurred in 2012, December 16th, and the Nirbhaya died on December 29th in 2012. After that, all the public people, health professionals, government of India, they become alert. And JC Verma committee was made, and POXO Act was made in 2012. And then, based on all these things, the government of India came with the guidelines of the medico legal care for a survivor of the sexual assault. Now, before 2013, when the act in criminal law came, the rape was defined as only the vaginal penetration of penis. But after that, there is a change in the definition, in the perspective of rape or sexual assault, which is simultaneously used. And now it consists of penetrative as well as non penetrative sexual act. So there is a gross change in the definition of rape after Nirbhaya case, and rape is a legal term, and we cannot define rape, or we can as a doctors we cannot accuse any person of rape. We can always only say that there has been a sexual activity or not. Now, once the the definition and the perspective of the rape changed, the medical evidence purview also changed, because previously the evidence collection, we were only concerned about the evidence collection in cases of rape, and that was only based on the presence of semen, spermatozoa and semen, because it was the penetrative sex, penile penetration. But now, since it has become a non-penetrative case also, so the findings are not only based on these evidences, this is based on history as well as corroborative evidences and the uh, present circumstances at that point. So this is the change in the amendment which has come in 2013. Now the Supreme Court, in a case of 1441 in 2022 October, has taken a very serious notes. That's why we are doing this exercise now on a very fast basis. And Honorable Supreme Court has given the decision that the all the state and government, union government, are supposed to ensure that the guidelines formulated by Ministry of Health and Family Welfare are circulated to all government and private hospitals. Secondly, we have to conduct workshops for health providers and communicate the appropriate procedure to be adopted while examining a case of sexually assaulted victim. And a medical review, curriculum review has to be done, where two finger test has totally to be abandoned. So this test is not to be recorded, not to be done, and it is not to be prescribed as one of the procedure to be done in cases of sexually assaulted victim. So taking these things in count, we have um, organized and we have made this revised film in 2023.
You'll be seeing this particular film at the end of the podcast. Dr. Sangeeta, when you are still on it, when a first step is when the survivor reaches the hospital, what is your philosophy of the total examination?
The philosophy of total examination is to give the comprehensive care to the patient, which includes the confidentiality of the patient, be passionate with the patient, and empathy has to be shown with the patient. A very systematic medical care and treatment has to be given, which includes the treatment of the injuries, treatment of the STIs, treatment of HIV, and if patient has to give emergency contraception to the patient, and a psychosocial care to the patient, and as well as forensic and clinical evidence collection. So these all are the part of the comprehensive care. We have to be very empathetic to the patient,
Yes.
to the
Uh,
survivor.
yes, we all know about it that the psychological trauma is lifelong, and these sexual assault survivors face 70% lifetime risk of what we call post traumatic stress disorders. And they are far too many. They don't leave this particular child. And at the same time, I think all of us must know about it that SOPs for every hospital should be made clearly, and there should be one person dedicated in charge of this particular cases, and the teamwork of any one of them who examines this has to take the total responsibility of examination, collecting the forensic evidence, and at the same time handing it over to the person in charge. So it is a total responsibility of one of the members of the team. But I think they have to go by the SOPs. The consent is non-negotiable. So on this particular thing, I just wish to ask you a couple of things, Dr. Anita Rajoria. Uh, if a patient is brought to you and the patient comes to you, is it mandatory for you to inform the police, Dr. Anita?
Good evening, ma'am, for this opportunity. Yes, of course, when a survivor comes on her own or is brought by someone, and if the police is not yet involved, it is mandatory on the part of medical officer or the attending physician to report the case to the police. It is mandated by law of land. So we have to inform police even if the survivor refuses. We have to counsel that okay, we'll inform the police, but it will be on you whether you want to further lodge an FIR or not, but law mandates us to inform the police.
So
Now,
I would like to make it clear
just
here.
1 minute. Yeah, just one message I just want to know. It 90% of the doctors feel कि ये सरकारी अस्पताल में ही ले जाना. Is it mandatory? You one of you answer.
No, it is not mandatory to go to a government hospital. As per the legal obligation and as per the Criminal Law Amendment Act, both private and government doctors are supposed to give the treatment without delay to the survivor of sexual assault, free of cost.
This was in the Supreme Court directive also, that all cases of sexual assault and vitriolage have to be attended even by private practitioners. They should do at least first aid has to be given, and medical legal examination has to be performed. They should have the necessary logistics for the same. So
Now,
it is very clear that
yes.
both private and government have to
If a person in a
give.
private sector refuses to examine such patients, what are the implications, Dr.
Yes,
Anita Rujar?
if a person refuses to examine or treat the patient as per section 166B, they are liable to be imprisonment for a term which may extend to 1 year, or with fine, or with both. So it is under law and provision of BSN that they are liable to be imprisonment or fine or both.
There is one this thing also, that the treatment or whatever first aid is being provided has to be costless to the patient. You cannot ask for any fee for that. So this has to be free of cost to any of the survivor.
Thank you. Thank you very much. Another misconception goes in people's mind that it is the female and a female doctor has to examine. What you have to say, Dr. Anita Rajoria?
If if a female doctor is there on the duty or is available on the floor, it is preferable that the female doctor examines. And if the gynecologist is available and the casualty medical officer seeks her opinion, then of course gynecologist may be there to attend to the patient, but it is not mandated by law. Even a male doctor can do the needful. Suppose the incidence has happened several kilometers away from a female doctor being available, so the male doctor can do in presence of a female chaperone, in which the survivor confides it can be a neutral bystander or any other staff, female staff of the hospital or healthcare facility.
I asked another question. In that particular district, there is no female doctor except one ophthalmologist who's a female doctor. Can she do the job?
Yes, ma'am. Every MBBS doctor should know how to do forensic evidence collection and examination, basic examination of these. Only where specialist care is required, only then we may need help of a gynec. Suppose she is
So
having
message
heavy
is
bleeding or
the
something.
message is loud and clear. Message is loud and clear. Now, Dr. Sangeeta, please tell me. I again repeat, the consent is non-negotiable. Now there are three kind of consents. Everybody should be very clear. Can you relate it with terms of age, whether patient refuse, at what age she can refuse, at what she can give consent, and that kind of, whether she can refuse, if she refuses MTP, what should be her age? So please relate these three consent with age. Make it very, very clear.
So, first consent is the consent of intercourse, which cannot be given below the age of 18 years. So, this is very uniform that any girl can have a consented sexual act only after the age of 18 years. Now, uh, if the survivor is above the age of 12 years, the survivor can give the consent for examination and treatment. But if the survivor is less than 12 years of age, the actual guardian or actual parents of the survivor has to give the consent. Now, if the guardian or patients are not, parents are not available, then any senior person on administrative post can give the consent for the examination and treatment. Then next, if the parents
MTP,
they
MTP.
if the parents they don't consent in the wrong interest of the child welfare committee has to be informed and consent has to be taken from the child welfare committee. But if the survivor requires a MTP, then the survivor's age should be minimum 18 years. She cannot give consent for medical termination of pregnancy if she is less than 18 years. And in emergency, for the doctor, no consent is required for emergency management, provided that is well documented on the case sheet that it was a emergency to give the treatment.
Yes, to say
Now, again, patient can refuse for the treatment, but refusal of consent is not a deterrent for giving the treatment. Patient may say that I don't want to inform police, I don't want to give evidence, I don't want to get examined. But if the treatment is required, the refusal of consent is not a deterrent, and the refusal of consent has to be documented very well in the report sheet or the case sheet of the patient.
yes, and you've made it very clear if the person is mentally challenged or a speech impaired, or the survivor is drugged in that particular patient, it has, the consent has to be given by the the guardian
Administrative.
and the partner. But in case if it is the nobody's available, who can give a consent? Can the police give consent for this, Anita
No.
No.
Rajoria? No.
No, ma'am, police cannot give the consent. Suppose the parents are not there, the survivor is brought by someone who is guardian. He or she may not be biological related to the survivor, but maybe suppose caretaker of a orphanage or something like that. Even the caretaker can give consent, because at that particular time he or she will be the legal guardian of the person concerned. And moreover, the consent has to envisage consent for medical examination, for medico legal examination, and also for sample collection. We have to counsel the survivor regarding the three different consents which are incorporated. And she can give partial consent for also. Suppose she can give for medical examination, but she might refuse to give sample collection. So we have to counsel that even refusal of giving consent will not hamper her treatment in interest of her medical condition at any point of time.
Uh,
And she can refuse in between also. Suppose she's in the process now, she's not, she's feeling awkward, or she's not now in a position that we'll ask her that it's okay, whenever you feel comfortable we'll do it in the next sitting. So she can refuse in between also. So this
And I would like
liberty
to add
and this liberty has to be given to the survivor. So
that
this gives a sense of autonomy to the survivor.
she has to be informed that during the procedure उसके कपड़े उतारने की जरूरत पड़ सकती है, हमें उसके हेयर काटने की जरूरत पड़ सकती है, नेल से सैंपल लेने की जरूरत पड़ सकती है. तो she has to be well made aware well of the procedure also of the examination and evidence collection.
But in case she
Refusal ki,
refuses, I think it is our duty to make her understand that what are the implications in case if the examination is not done.
Very
So
true, very true.
this is which is very very important. Uh, Now, how the confidentiality is maintained, Dr. Anita and Dr. Sangeeta? Uh, in any case, how the
yeah, that is
confidentiality.
that
Huh,
that is the prime responsibility of the attending doctor.
hmm.
The survivor has to feel very very confident that whatever is happening is not being shared with anyone. Total privacy, in total privacy the examination is done. And government has given directives that one should have ideally one stop centers where the care is given under one roof, the medical legal examination is done, and where the privacy and confidentiality is maintained. If the survivor feels uncomfortable, we can counsel her in presence of chaperone, as I had already highlighted, that she may ask her any attendant in which she confides to be there at the time of even examination. But it has not to be the police personnel, but any other person in whom she feels confidence. And the confidentiality and privacy has to be maintained in each and every stage of counseling, history taking, examination, evidence collection, and handing over to police. The identity of survivor has not to be revealed to any unrelated person or unauthorized person.
Very very important. You mentioned about the one stop crisis center. I will say it saves life. Not only it saves life, all emergency part can be taken care at one particular place. And you find that these patients, even the reporting is supposed to be 40-50% better. You want now sometime, the survivor which is brought is uh, under the effect of intoxication, maybe alcohol or some drugs. What care has to be taken in terms of toxicology?
So, if you feel that a patient is under some kind of sedative or some intoxication or alcohol effect is there, we have to be very, very cautious. First of all, consent part is very, very important, because an intoxicated or drug person who is not in complete senses cannot give consent. So, we have to be very, very careful in taking consent of this kind of survivor. And besides doing other medical legal examination, we have to withdraw blood sample and urine sample to know which kind of drug was given to the particular survivor, or was she under effect of alcohol at that particular moment of time. So it becomes utmost important that medical legal examination is done as early as possible, because with passage of time we are going to lose evidence. So besides other examination, in such cases blood sample and urine sample has to be preserved and handed over to police to know the drug as well as alcohol level in the blood and urine.
Dr. Anita, thank you very much for emphasizing that forensic evidence decays rapidly, and so it has to be done within 72 hours. Though delayed, it can be done, but it will not be as good as far as the evidence is concerned. It should be preferably done within 72 hours. At the same time, I will say, what Dr. Sangeeta, will you summarize what are the total sum up of as far the examination part is concerned? What all is included here?
So again, I say that it the medical, we name it as a medico legal care. So it is not only the medical examination, it is the comprehensive care given to the patient, which is step by step it occurs. So first step is to give emergency management to the patient. Second step is to take the consent of the patient. Third step is to take the history of the patient, that where the assault has occurred, what is the time, what was the time at the time of assault, what are the type of assault it is, whether it is a penetrating assault, whether the act was complete. So detailed history of the patient regarding the assault, as well as the general medical history and surgical history of the patient has to be taken. Then patient's examination has to be done. Now examination is to be done for the injuries which are
And
present, which will be all over the body or the local injuries. Then fifth step comes of the evidence
evidence.
collection. So during the evidence collection, you have to take the clothing of the patient, and you have to take the clippings of the patient. So collection means the evidence has to be two type. One is the clinical evidence collection, and one is the forensic evidence collection. In the forensic evidence collection, now the Supreme Court has made it mandatory to have the DNA collection, DNA sample of the patient. So DNA sample has to be taken in the form of blood, in the form of nail, in the form of hair, in the form of the vaginal swab collection for the semen, spermatozoa, mobile spermatozoa, depending upon the history of the patient. So the whole evidence collection depends upon the history of the assault, time lapse of the assault, and the activities done after the assault. After that, patient has to be given treatment. I am telling the whole comprehensive. Patient has to be given treatment for STDs, STIs, HIV, pregnancy prophylaxis, and
We
all
will
that.
we'll take it up. Dr. Sangeeta will take it up later. Now there is another term, Dr. Adita Rojoria, what we call chain of custody for forensic evidence. What we mean by this?
The chain of custody means that whatever evidence we are collecting in form of swabs or samples, they have to be properly, sealed, signed and stamped individually in envelopes, as we'll be showing in the film also. And then the box has also been sealed carefully, signed and stamped. It should be tamper proof, and there is a paper on that in which the chain of custody, every hand that the sample passes through, they will put their name, their designation and signature. Suppose the evidence is collected in the night and the police says we will take the samples in the morning, so it becomes a duty of the doctor to keep it at a safe place under lock and key, and it should be kept in the refrigerator. And as soon as, suppose we are handing it over to the nurse concerned, so she will be the next person in the chain of custody. She has to receive it, sign it, and then the next day when the police comes, then the third person has to again receive it, sign it, and then it will be properly handed over to the investigating officer. So this is called the maintenance of chain of custody, so that at any moment of time court doesn't feel that the evidence was tampered in any
Now,
way.
now one small thing. I think the minors have to be handled differently. We will talk at another forum about the POXO Act. Not going to handle it, but is it necessary that general anesthesia has to be given for a person who is timid in examination, Dr. Sangeeta?
No, it is not mandatory to give anesthesia at all. It is the anesthesia has to be given only when it is required for the medical treatment of that child, that she is bleeding profusely and one is not able to examine the child without anesthesia. Only in that case anesthesia has to be given, but it is not mandatory to give anesthesia for examination or evidence collection.
Dr. Anita, make it very clear what are the lab tests should be performed within the hospital and outside. Can you just sum up again?
Yeah. So the evidence collection is for medico legal care,
DNA
contain has
prophylaxis.
two types. One is for hospital. In hospital you are going to do urine pregnancy test also, you are going to withdraw the sample, you have to screen the girl for syphilis, for viral markers like hepatitis B, and if facilities are there for hepatitis C and HIV also. These will be the baseline screening tests which have to be done along with other, because sometimes patient may need even blood transfusion, she might have lost blood, so basic investigations have to be sent to the local lab of the concerned healthcare facility, and rest of the samples which are there in the safe kit will be handed over to investigating officer. So both of these things are important, because the local lab reports will, it can alter the treatment course of your survivor.
Perfect. Now, another thing, doctors mishandle as far as the preservation of biological samples are concerned. So, I think they must be very clear that all samples have to be air dried. Should be stored in a paper bags and are not in a plastic bag, and properly refrigerated in case you can't hand over the material immediately to the investigating officer. All this are required to prevent degradation. Anything else you want to add as far as this part is concerned, and then we will take up things now.
Very true, madam.
Coming
And
very,
also the
very
products of conception. The products of conception for medical legal aspect has to be preserved in a fridge at the 4-degree temperature. So, and the police has to be informed that collect the sample as early as possible. And even if after you're saying police is not collecting the sample, you have to inform the higher authority in the chain to tell them कि this is the samples are not being collected from our hospitals, so please arrange to collect them as early as possible.
I'm repeating this particular question again, and trying to inform everybody that survivors have 30% risk of contracting sexually transmitted infections, and that is why we have to see to it that in case if she is a high risk case of this thing, then a post exposure prophylaxis has to be given. Patient should be given an emergency contraceptive, because it is going to work in the first 24 hours if you do it 95% if it is effective, but if it is later than 72 hours, the purpose is all gone. The similar way, we need to see to it not only the pregnancy prevention, the STI prevention. In case if any one of these things you will not do, it will amount to medical negligence. And at the same time, we find 60% of the survivors say when the doctors examine, they find that it is re-traumatization by professionals. Dr. Anita Rajwaria, what you have to say on this particular thing, emphasizing on this particular points?
Yes, ma'am. Again, to reiterate what you have already highlighted, it is very important to do the basal screening, and the patient has to be, the survivor has to be incorporated in a very strong follow up mechanism also. Because not only at the time of first attendance, we have to keep her under follow up to see whether she doesn't contract HIV or any other kind of sexually transmitted infection during the course. So it becomes very very relevant. She may not be UPT positive at the time of initial attendance, but during follow up we should strictly monitor. Despite giving emergency contraceptive, we know the efficacy of ECs, emergency contraception. We must again repeat urine pregnancy test after 3 to 4 hours when she comes, because it will be very negligent on our part. There was one directive by court that one survivor contracted HIV because of this sexual assault. So we have to be very very careful. The screening has to be done regularly in follow up, at least after 1 month HIV, and after 6 months also we must keep her under follow up and look out for any signs of development of any kind of sexually transmitted infection.
Now, coming to the very final part of it, 50% cases, the medical opinion which is given is not right. We find that we have a lousy examination, lousy collection, the samples are not sealed, labeled, all this go flat in the court in case if anything there is a lapse. Now coming to medical examination, what is Dr. Sangeeta, tell me something, what is the importance, because medical opinion के ऊपर ही तो सारा तारोमदाल है, तो इस मेडिकल
Uh,
ओपिनियन के बारे में क्या करेंगे, इसका क्या लिमिटेशंस हो सकता है मेडिकल ओपिनियन,
अब अब
because this is
मैं
what the Supreme Court wants, yes.
आई विल नाउ टेल यू दिस स्टेप वाइज कि एक मेडिकल ओपिनियन में हमें क्या क्या लिखना होता है। हमें लिखना होता है, वी वांट टू हाईलाइट वेदर द सेक्सुअल एक्ट हैज बीन अटेम्प्टेड, इट इज नॉट रेप, इट इज द सेक्सुअल एक्ट हैज बीन अटेम्प्टेड or completed, may it be a penetrative, whether it has been a penetrative one or a non-penetrative one. Secondly, the age of the survivor, we have to give opinion about the age of the survivor. Opinion has to be given, but estimation of age is not mandatory in each and every case. If we can opine about the age of the patient based on the age birth certificate or any other certificate, secondary school certificate of the patient, there is no need to do the age estimation other than when police emphasizes. So if police emphasizes, then we have to do age estimation, but opinion about the age has to be given. Thirdly, we have to give opinion whether the survivor has been under the effect of drugs, alcohol, or any other intoxication. So this is the third opinion. And fourth opinion is there any evidence to identify assailant? That means evidence collection, that what all forensic material we have collected. So we have to give the opinion about these things, and the opinion can be a provisional opinion or it can be final opinion. So provisional opinion is given just after the examination, and final opinion is given when the reports from the forensic lab are available with us. So it is very important that if you have any positive finding during your first examination, that you document that positive finding, because it will give help to the police to take action against the accused. But if we don't give the positive opinion, if there is any positive finding, then accused gets bail or it gets scot free. So we have to be very confident. It has to be scientific, reasoned opinion based on this scientific basis, and reasoning based on the history and physical examination. So the court says is very clear that your opinion has to be scientific and based on the reasons that injury is present or not. So this is the reason. Any intoxication is, so all your opinion has to be guided and based on the reasons.
So
I will tell
history
you,
is very important.
Very
Eliciting
important.
good history is important, and your examination will be based. Now, court will not ask you why did you not collect vaginal swab if there was a history of only oral sex. So it will be history based, and it will be depending on the duration which has lapsed. Suppose she came after 1 month, there will be no point in collecting the swabs, although they say that dead sperms may be there in the crypts of endocervical canal for up to 3 weeks, but history will determine which sample has to be collected at that
let me
particular
come to the
moment of
direct
time.
questions. Now, can the doctor give opinion on whether the rape or the sexual assault occurred? You have already said, but I want to reiterate it. Dr. Sangeeta.
No, doctor cannot say that rape has occurred, because rape is a legal term which is decided by the court or the law. Doctor can only say that there is a recent sexual act or not, and that too, the whole scenario has changed as far as medical evidence and opinion is concerned in the revised law of 2013, where there cannot be we may not find any evidence when it is a non penetrating sexual assault. So everything has changed, and evidence has got a very limited effect as far as non penetrating sex is concerned. assault. Because
One more caution which has been told to examining doctors is never comment on vaginal introitus laxity or anal verge
I will come.
laxity.
Yes,
Yeah.
I will come to it. Now, I will take one, this thing, she has already talked about that you have to give a provisional report and you have to give the final report. Now, sometime it happens, there is a strong history. But once you examine this particular patient, the physical examination, the gentle injuries are absent. The FSL report is also shows absence of semen, alcohol, drugs, and everything. Now, what report you should be given in such cases, Dr. Anita?
Yeah, because it can be, misleading if the survivor was, intoxicated or drugged, or she was, assaulted under knife. Then she will not have any, she will not show any resistance. There will not be injuries. So there was lot of, brainstorming by lawyers, judges, and doctors. We sat together and they told us how to write provisional medical opinion. It has become very easy now for doctors because the safe kit has got that particular book in which only four options are there, because court understands, everybody understands that under intoxication or fear she might have not resisted. There may not be any genital or any physical injury, because she may not be strong enough to give the resistance to the assailant. So there are only four medical opinion options are there. The medical officer has to logically take one of them. The four options are that genital and physically injuries are present, which are suggestive of forceful penetration or insertion. The second option is only genital injuries are present, suggestive of forceful penetration or insertion, or only physical injuries are present, suggestive of use of force. However, penetration or insertion cannot be ruled out. This is the way they have framed the words. The last option is neither genital nor physical injury is present, but there is suggestive of no use of force. However, again, sexual assault cannot be ruled out, because as madam was asking, she might be drugged, she might be under intoxication, or lot of fear must be there in her mind. So there may not be any genital. So the best option has to be taken, and after the forensic labs give the report, the final opinion will be given only after that.
Yes.
I will
I
add
came
that there
across.
may be a use of lubricant which might not have caused the injury. So the mention of the use of lubricant or the FSL report of lubricant is mandatory. And secondly,
I came across a template which says that you should write down in
yeah,
such cases the possibility of sexual violence cannot be ruled
Not
out
be
on
ruled out.
account of the history provided by the survivor, or in victim in relation to the nature of assault, activities undertaken after the assault, and at the time lapse between assault and the medical examination. So, if you write these kind of things, things get sorted out. Now, lastly, now sometime you find, how should a doctor respond to the police requisition asking to find out whether the person is habituated to sex after medical examination of the person. कई बार वो
We
आपको
can
फोर्स करते हैं, आप क्या करोगे?
no, we
It
can
is
gently
illegal.
decline. Yeah.
हाँ, it is illegal.
We should not, we should never comment on vaginal laxity, or if anal this thing has happened, not even anal laxity. So that is very very important, and court has given a clear directive against commenting upon previous sexual experiences.
In fact, now coming to the final call of action, because we have a very little time left. uh, Now you've seen that rape or sexual assault is just not a crime, it is a societal annihilation. And you can see the kind of post exposures, stress disorders are far too many. I think that all care providers or lawyers, every and police persons must read this particular law of 2013, and each and every line should be very very clear to them. And I think health care providers, I can only request that they should empower themselves in the medical examination. They should be able to write a proper medical opinion, and will be the first line of defense for this sexual assault victim. Our empathy, our precision in examination, our precision in collecting the forensic material, and to speak the truth and nothing but the truth is the most important. I would like Dr. Anita Rajoria to sum up in one line, and so is the Sangeeta.
Ma'am, I just wanted to add one thing, because you were
Yes, yes,
giving
yes.
case history that no semen was found. Even the assailant could have used conventional
Condom.
contraceptives or condoms, so you will
Correct.
not
Or
You
find
know,
any.
vasectomized.
these are the
Assailant could have been
limitations. Yes.
vasectomized.
Yeah, so
There
that
will
is
be
why.
some disease of vas difference.
So sexual assault cannot be ruled out. It is, framing of opinion is very, very important. So now at the end, I'll just like to sum up that it is mandatory for a doctor to do the reporting to the police if the survivor has come on her own or brought by someone else. Then a thorough, you have to develop a rapport with the patient, give her, you have to counsel her, take good history. If she needs any emergency medical aid, you have to immediately provide her. You should not wait for the police information to be sent. If any emergency treatment is required, take a thorough history, take good consent covering all the three aspects, then examine her thoroughly. General examination, local examination, examination of breast has to be done. Collect samples properly and see the film we are going to show after this for to know how the collection has to be made in proper order. Document everything. That is also very important. You have done and you're not documented, that means it has not been done. Mark your envelopes properly, and suppose if you have not used any envelope, right, no sample was collected for that particular envelope. Seal the safe box carefully, maintain the chain of custody after writing the provisional opinion. In that, it has to be put inside only along with that, and hand over to the police, take a receipt against that, and provide a good psychological and medical attention to the survivor. Keep her in follow up as per guidelines, screen her often, give her treatment if she develops any kind of problem later on, offer safe MTP services. That is also very, very important. And it is good that we respect the autonomy of the survivor. So I think I'll stop here and will ask
I
Sangeeta
would
ma'am if she
only
wants to add
I would
anything.
like to add only few points in it. Again, to reiterate, rape is not a physician's term, it is a legal issue, so nobody has
Perfect.
to be say that rape is occurred or not. Secondly, always inform police. It is your duty to inform police. So there is a difference between a MLC and a FIR. You have to inform the police. Then it is patient survivor's choice whether she wants to lodge a FIR or not. But you have to inform the police. Per vagina two finger test not to be done. Past sexual history comment should not be there. There should not be any comment on the torn hymen or anything. No such local examination comment has to be there. Injury has to be well documented. Age estimation is age opinion is important. Estimation as per requirement. Report should be made in triplicate. One has to be with the doctor, one has to be with the patient, and one has
Patient.
to be with the police. So you have to make it in triplicate. Opinion drafting should be based on the reasons. And as Dr. Anita said, forensic evidence collection chain custody has to be maintained. It is the duty of the examining doctor
Yeah.
for maintaining the evidence chain custody and handing over to the police. This
Yes.
is the duty
I,
of the
I, I
examining.
think this is a very important medical negligence, and there are many cases are against the doctors where it is unpardonable. Now, secondly, lastly, I just want to add up over and above the long-term gynecological implications are there in such cases. These patients can have a chronic pelvic pain. They can have a problem of infertility in nearly 25% of cases, or maybe little more. And I think When we do a life skill workshops in the schools, it should be done, and the importance of consent should be told to them. There was a UN report says that the schools which you teach them, they find the incidence of rape cases in such cases is much less. And you find uh, timely justice heals the patient, and then you
Very true.
find that the effect of these stress disorders, post-traumatic stress disorders, is much less in such patients. In the end, I will say that every 15 minutes one rape case is happening, and 90% of cases are still unreported. So I think, all medical fraternity, including nurses, everybody should wake up. They should break their silence, and they should get empowered to do a absolutely 100% great medical examination, collection of samples. So this particular girl should get the justice. In today's time, 50% cases go against her because of want of evidence and the documentation. And that's why Supreme Court wants you to be empowered as far as the medical examination is concerned. Every MBBS doctor should know this particular thing. You cannot say that you will not do it. If you say that, it is amounts to litigations and imprisonment. So with that, we will come to the final thing, that please, it will be great if there are any questions, Shizen. We will take it up before we show the film.
Thank you, ma'am. We haven't received any questions.
No, we will have the film. I think it had been a very satisfying podcast. I'm very delighted that Dr. Sangeeta Gupta and Anita Rajoria informed each and everybody, what are the implications are there, and we must do a great job of medical examination.
And we have got our website as far as the Delhi Gynecologist Forum is concerned, and anybody can approach us if they have any question later on after seeing the film in their mind. They can approach us. They can approach through you, Sharon, and we will be very happy to answer all the queries, because we all have the mission
We are
in our
committed, and a
hand that
mission we
every
have.
doctor
Yes.
should be expert. So we want to complete it. So we are there for your help, for your queries, for your answers, for your questions.
Definitely, ma'am.
Thank,
Thank
Thank you
you.
very much.
thank you for the opportunity.
Thank you so much, ma'am. It was a
Let's
wonderful
end.
session. And let's just play the movie.
Yes. Our pics can be off.
On the website of the Crime Bureau of India is posted a crime clock. The clock never stops ticking, nor do the rapes.
This is a true illustration. A girl was brought from a village to a city for domestic work. She was sold to a brothel. She was recovered during a raid on the brothel. On medical examination, it was found that she had been physically tortured and her genitalias had been dilated with tampons to adjust to disproportionate male organ. She also showed old healed hymen and tears in the vaginal wall. She was tested positive for gonorrhea, and semen traces were also recovered from stains. An age determination test corroborated she was just 12 years.
A young girl is imported for commercial sexual exploitation. It is the beginning of repeated sexual assaults on the adolescent. The number of sexual assaults on her rise with every passing hour. Social scientists make 4 points. The statistics reported by the Crime Bureau are just the tip of the iceberg. Owing to guilt, shame, cultural compulsions, and poor knowledge of law, very few cases of sexual abuse are disclosed and reported in our country. It is a fact that both rape and sexual trafficking cases are on the rise. In our land, conviction rate of rapists and sexual criminals is very low. Varying from state to state, only 20 to 30% of the accused get convicted and punished. There is a relationship between conviction rate and sexual crimes. Higher conviction rate can help in the prevention of sexual crimes and trafficking. Doctors are the most crucial link in raising the conviction rate. In all the sexual abuse cases in the court of law, the evidence collected by the doctors through medical examination of the rape victim, the age determination test, and the medical legal report play a key role in deciding whether the offender will get convicted or not.
All of us are clear that to prevent rape and immoral sexual trafficking, the conviction rate must be raised in our country today. The right legislation is in place. What is needed is medical evidence that goes in favor of the victim in the court of law. As the nodal agency for controlling trafficking, Indian Medical Association is committed to raise the conviction rate and to get justice to the rape victims. Indian Medical Association's approach is bilateral. It is seeking the government support to establish rape crisis centers in the entire country. At the same time, it has taken up steps to equip the medical officers with the skills required for providing accurate medical evidence. This film is a part of that process. Through this film, my colleagues here, Dr. Sunita Fotedar, Senior Specialist Department of Gynae, Swami Dayanand Hospital, Shahadra, Dr. Sangeeta Gupta, Head of the Department of Gynae, ESI Hospital, Basai Darapur, and Dr. Gaurav Agarwal, the former Assistant Professor, Vardhaman Mahavir Medical College and Safdarjung Hospital, will take you through the entire process of medical examination through a standard protocol to be followed throughout the country. The original film was made on the request of Ministry of Women and Child Development in 2006, with the aim of imparting knowledge about standardized and uniform medical legal examination of survivor of sexual assault. And now it is revised in 2023 by Delhi Gynecologist Forum and North India Gynecologist Forum based on Government of India guidelines of 2014 after Nirbhaya's case. We also incorporated POCSO Act of 2012 for medical fraternities' knowledge and compliance. The Honorable Supreme Court of India is serious and taken a landmark decision on 31st October 22. Supreme Court directed the union government as well as the state governments to ensure that the guidelines formulated by Ministry of Health and Family Welfare to be circulated to all government and private hospitals. Conduct workshops for health providers to communicate the appropriate procedure to be adopted while examining the survivors of sexual assault and rape. Review the curriculum in medical schools with a view to ensure that the two-finger test or per-vaginal examination is not prescribed as one of the procedures to be adopted while examining survivors of sexual assault and rape. Guidelines and protocols on medical legal care for survivors, victims of sexual violence. Based on the guidelines of Ministry of Health and Family Welfare 2014. The guidelines are essentially aimed at doctors who might one day be called upon handle the survivor of sexual assault in the course of their duty, whether in government hospital or private. Sexual assault victim cannot be denied treatment in either of these hospitals when they approach them, as denial has lately been made a cognizable criminal offense punishable with appropriate jail terms or fines or both. Apart from attending or treating, doctors' responsibility and duty is in recording and documenting the medical aspects in order that such cases, when they come before the criminal justice system, are not found wanting in the quality of evidence produced by the prosecution during trial leading otherwise to poor conviction in rape cases. There are legal obligation of health professionals. As per section 164A of Criminal Procedure Code, examination of a case of a rape shall be conducted by registered medical practitioner without delay and a meticulous report to be prepared by the RMP. The health professional need to respond comprehensively to the need of survivors. Comprehensive response care means initial resuscitation and first aid, informed consent, detailed history taking, medical examination, age estimation if requested by the investigating agency, evidence collection as per the protocol of Government of India 2014. Documentation, packing, sealing, and handling over the collection evidence to police, treatment of injuries, testing, prophylaxis for STIs, HIV, hepatitis B, and pregnancy, psychological support and counseling, referral for further help to shelter home or for legal support. This particular chart gives you overview of this comprehensive response care. Operation guidelines. Every hospital, clinic must have a standard operating procedure for management of sexual violence to provide comprehensive services for the smooth handling of cases and clarity of roles of each staff, to have uniform practices across all doctors in the hospital. The POCSO Act has come into force with effect from November 2012, along with the rules framed. It is a comprehensive law to provide protection to the children from the offense of sexual assault, sexual harassment, and pornography, to safeguard the interests of the child at every stage of judicial process for the proper development of child in view of his or her protection of the right to privacy and confidentiality. The most important provision of the Act is that it gives a definition of the child. It defines different forms of sexual abuse, including penetrative and non-penetrative assault, and what constitutes aggravated sexual assault. The prescribed punishment, the mandatory reporting of the crime. It is also important that abatement of offense under the Act would also attract the punishment as that of the offense committed. Examination of the child shall be conducted even before a FIR or a complaint is registered by a government doctor in a government hospital or a hospital run by local authority, with the consent of the child or of a person competent to give consent on the behalf of the child. The examination must be done within 24 hours from the time of receiving information about the offense. Anesthesia can be administered only in those cases to enable medical examination which are done in the best interest of survivor and are not possible otherwise. The doctor shall forward the report to the investigating officer without any delay, who shall forward it to the magistrate. As far as consent is concerned, in the POCSO Act, a child is one who is aged below 18 years. Minimum age of survivor for giving valid consent for medical examination is 12 years as per provision of section 89 and 90 of IPC. In case of child below 12 years of age, whenever parents and or guardians are not available for giving consent for examination, then informed consent can be obtained from a panel of senior doctors in an administrative position in the hospital who will act in the best interest of the child. When doctor suspects that the child has been or is being sexually abused, even in the absence of consent of a child or a parent, have mandatory legal obligation to report child sexual assault cases to the appropriate authorities. If he fails to do so, he may be liable for punishment of imprisonment of up to 6 months with or without fine. Standard protocol for medical legal examination of survivor or sexual assault is prepared by National Institute of Criminology and Forensic Medicine, Ministry of Home Affairs, Government of India. The main aim of standard protocol is to collect evidentiary material without missing any step during medical legal examination of survivors of sexual assault. Now, points to remember. Incident of rape occurred or not is a legal issue and not a medical diagnosis. Hence, on the basis of medical examination, doctors should not conclude whether rape has occurred or not. Another point on spermatozoa. Spermatozoa may be recovered from cervix and posterior fornix for longer period of time than in vagina after the assault. Hence, it is advisable to collect swabs up to at least 3 weeks after the assault, as per merit of the case and whether possible considering the age of survivor. This table clearly presents that the motile sperms can be seen up to 7 to 8 days, while non-motile sperms can be seen in vagina up to 10 days and in the cervix up to 19 days. Informed consent. The consent of the survivor must be taken before examination. If the survivor is less than 12 years, obtain the consent of parent or guardian. A doctor must inform the survivor, parent, or guardian regarding the nature and the purpose of examination. That the examination will help in prosecution of those who committed the crime. That the procedure may involve an examination of the mouth, breasts, vagina, anus, and rectum. That the examination may include removing and isolating clothing and samples such as scalp hair, genital swabs, nails clipping, blood, etc. That the survivor or the parent or guardian, any other person in whom the child reposes trust, has a legal right to refuse full or part of the examination. That refusal of consent would not affect her treatment aspect of the survivor, but may hinder the conviction of the accused. Informed refusal must be recorded with the signature of the survivor and witness. Information to police. As per law, the examining doctor is required to inform the police about the incident, irrespective of the consent for examination. Point to remember, as far as per vaginum and per speculum examination is concerned, should not be done unless required for detection of injuries or for medical treatment. No comment should be made on shape, size, and elasticity of the anal and vaginal opening or about previous sexual experience or habituation to anal or vaginal intercourse. Two-finger test, neither to be conducted nor commented upon. Injury documentation must be done in all cases. Toluidine blue dye, alternate light source, wood lamp, colposcope may be used wherever required to highlight injuries, bite marks invisible to the naked eye. Depict the injuries on appropriately body diagrams and record with details the size, site, shape, color, etc. Absence of injuries may be due to inability of the survivor to offer resistance to the assailant because of intoxication, threats, and unconsciousness. Age estimation is an important part of the survivor examination, if relevant or asked by the police or court. Medical legal examination report has to be made in triplicate. The original has to be given to the police, the second copy for survivor, and the third for the hospital record. Forensic evidence collection. Strive to collect as much evidence as possible from survivor, guided by scope of informed consent, history given regarding sexual assault, and examination findings. Forensic evidence collection, packaging, and forwarding of evidence material for forensic analysis. Based upon the history of the case, evidence material should be collected in pre-labeled envelope contained in the evidence collection kit. The swabs must be thoroughly dried before putting it into envelopes. The clothing, if wet or having body fluid stained, should be thoroughly air washed before packing. reference blood sample of the survivor should preferably be collected on blood collection card for DNA testing as well. For this, wipe the tip of the ring or middle finger with betadine swab, prick it with sterile lancet, and allow a few drops of the blood to fall within the circle of the card. Dry it before packing. This is the forensic evidence collection kit called SAFE kit. Collection of samples for hospital lab are blood for HIV, VDRL, and hepatitis B, urine tests for pregnancy, ultrasound for pregnancy, internal injury, X-ray for injury. If no evidence material is collected in any envelope of the kit, the envelope should be crossed and no sample collected should be written on it. The evidence collection kit should be sealed with tamper-proof seal. Medical sample should be sent to hospital lab and forensic samples should be packed in evidence collection kit. Provisional opinion drafting should be done immediately after examination of survivor on the basis of case particulars and findings of detailed clinical examination. Final opinion to be formulated after receiving the reports of the forensic lab. It should be always kept in mind that a normal examination findings neither refute nor confirm the forceful sexual intercourse. Hence, circumstantial and other evidence may be taken into consideration. The types of evidence to be collected will depend on the actual time of medical examination. Post-sexual violence, keeping in mind that there could be delays in reaching the healthcare facility for medical examination due to various social issues and barriers. Hope this film inspires you to do perfect medico-legal examination.
Elimination of sexual abuse and trafficking of women and children for sexual exploitation is a key priority area for the Department of Women and Child Development. The department is studying the problem in greater depth and collating data. It is building awareness in civil society and NGOs. It is advocating national legislation at par with international and regional instruments for eliminating trafficking. The film will now instruct you on how to conduct a state-of-the-art examination of a young female sexual assault victim, medical forensic examination with in-depth explanation, age determination. Summary of forensic examination. The film has the following learning objectives: to introduce a standard kit with all the tools required for medical examination, to learn proper method of conducting the forensic history and physical examination, to learn proper evidence collection techniques, to learn the right procedures of age determination, to learn the prophylactic regimens to prevent disease and unwanted pregnancy, to know where to access technical information on forensic medical examination. This here is a standardized kit being demonstrated. In some cases, you may not need to use all the envelopes of the kit. For example, if no debris is found on the body surface, the packet of debris will not be used, and no specimen will be written across the label. In other situations, you may need extra supplies in the form of needles and oral swabs from the hospital stores. For successful forensic examination, you must do the following. Pay a thorough and close attention to details. Wear gloves at all times. Touching the victim, the kit, or its contents with bare hands may leave your DNA in the evidence. Wear powderless gloves if possible, since the powder may interfere with the laboratory examination. Moisten the speculum with warm water, not with lubricating jelly, as the jelly may interfere with forensic tests. Before the examining physician comes, let a trained nurse calm and reassure the young victim. Building rapport with the victim is crucial. Otherwise, the victim will be hesitant to talk, making her own case weak. Let her explain to the victim gently what the medical examination is all about and its importance for the trial. Remove her fears about the process she is going to go through. This is a very important and critical step. Let the paramedic staff give the victim undivided attention for a few minutes. The step one is to get the legal consent form signed. The doctor must take the legal consent before she begins the evaluation. Please explain to the victim what the consent is for, why the girl must sign it, and how it is going to help her get justice. Consent must be taken in the victim's native language.
Legal consent is a must in every type of medical legal case, be it a police referral, be it a direct request of the victim or her guardian for a medical examination, be it a rape case or a case of sexual trafficking for commercial sexual abuse.
It's important that the physician's and the paramedic staff's attitude be non-judgmental. It is a commonly held prejudice in our culture that the girls who get raped are the loose and bad sorts of girls who invite it. Inquire within and make sure that this is not the attitude you or your staff holds. Such an attitude, if harbored and communicated, will create negative feelings and the victim will become uncooperative. Make sure that the examination meant to help the abused child doesn't itself become a source of distress for her. Second, as a physician, it is not your responsibility to determine whether a rape took place or not. Your responsibility is only to carefully examine the victim, collect the evidence, and document the findings. Never comment whether a rape has taken place or not. Rape is a legal term, and only a court of law can comment upon it.
बेटा अब मैं तुमसे कुछ सवाल पूछूंगी पहले ये बताओ ये हादसा कब हुआ
Now the next step is to start filling the examining physician's report. The first page is a detailed history form. It is not all inclusive, but covers most of the questions which need to be asked about the victim. Be aware that some victims may not understand medical terms. It is sometimes necessary to describe body parts or specific sexual behavior.
तो ये हादसा तुम्हारे साथ कल रात 10 बजे हुआ अब मुझे जरा सोच के बताओ कि उसने तुम्हारे साथ संभोग किया मतलब अपना अंग तुम्हारे अंदर डाला
Occasionally, it may be necessary to use more explicit or even slang terms to ensure the victim clearly understands the question.
उसने स्खलन भी किया
Video
Hello.
has stopped. Sran,
Yeah,
please check.
it is. Yeah, it is stopped. Actually, she left, I think.
Should I tell ma'am?
Shadda ma'am, can you please check? So, Anita ma'am, I just had a word with Shata ma'am. So, there's some technical issue for which the video can't be played anymore. So, it's been a wonderful session, ma'am. With your permission, with everybody permission, I would like to conclude today's session. Thank you so much
Yeah,
for joining.
what we can do is we'll share the link in all the groups so that they can watch at leisure,
Definitely,
because it
definitely.
needs very careful watching, because every slide and every step is important. So I'm really thankful to you for giving us this platform to share our views with our colleagues and our friends. And I think it will go a long way in helping medical officers to learn the know-how of art and science of collection of forensic evidence collection. Thank you, Sangeeta ma'am, and thank you, Dr. Sharda ji.
Thanks. It was a nice discussion, and I again request all the viewers to ask any question from us regarding the examination of a sexually assaulted survivor, because we really want to solve any query, any type of query. If it is there, we are there to help these people. And I think it was a great opportunity for all of us to have a first step towards completing our mission. And thanks a lot, IJCP, for giving us this platform.
Thank you so much, ma'am, for joining us today. It's our pleasure. Thank you.